Hi, Bill Mobley at the ANA, and talking now with Aisling Carr about her very interesting poster talking about acute respiratory failure in Belfast, the Royal Victoria Hospital in Belfast. Aisling, welcome.
Thank you.
And talk to us about what you've learned.
So, acute neuromuscular respiratory failure is a complication of a number of neurological conditions, often requiring prolonged and intensive respiratory support. Previous literature on outcome in this area has concentrated on specific diagnoses such as Guillain-Barré syndrome and myasthenia gravis. However, quite a significant proportion of these cases do not have a definitive diagnosis on initial presentation to intensive care. So the differential diagnosis in these cases can be broad, and prognosis varies significantly depending on cause. There's only been one previous paper on etiological spectrum on this patient cohort, a study from the Mayo Clinic, which was unfortunately limited due to short follow-up time, and also was probably biased due to the referral of complex cases to such a specialist centre. So we sought to examine from a population-based point of view the frequency, etiological spectrum and outcome in this patient group. We examined two separate ICU databases to identify patients from within Northern Ireland, which is ideally placed for neuroepidemiological study because the denominator population is very reliable, as it is bordered to the south by a separate healthcare system in the Republic of Ireland, and very few people would travel to mainland UK. It's well served by 17 consultant neurologists to one centralised neurology inpatient
So that's
centre.
an advantage for sure. Absolutely.
Yeah.
Good.
So we're very reliable epidemiology from that point of view. In our study we identified 55 patients requiring admission to ICU with neuromuscular failure over an 11-year period. We were able to establish minimal epidemiological statistics, including an incidence rate of 3.2 cases per million person years and a mortality rate of 0.3 cases per million person years. Most common cause for admission was Guillain-Barré syndrome, followed by myasthenia gravis, but a small proportion, 5 out of the 55, ultimately were diagnosed with motor neuron disease.
Interesting.
When we compared the neuromuscular disease cohort to the larger cohort of all neurology patients requiring ICU admission, we found a number of interesting differences. Notably, the neuromuscular respiratory failure cases were older and stayed in required ICU admission for a longer period of time. However, overall, their outcome as measured by a modified Rankin score was significantly better, and the proportion of in-hospital deaths was significantly lower. So this is a group of patients who do require prolonged care and support. However, they do well in the very long term. So we think that our data is not only useful for health service planning, but also is encouraging statistics to have in the decision-making process for individual cases.
Very good. And so undiagnosed cases are part of the mix,
Yeah.
and one has to put one's best effort to make that diagnosis to better understand prognosis. Very good. Thank you.
No problem.
Appreciate that.